Welcome, my dear students. Today, we are going to have a lecture on history of anesthesia. Why history of anesthesia is important? Anesthesia deals with control the unusual sensation of pain. So, according to the definition of International Association of Study of Pain, that's ISP, pain is defined as unpleasant subjective feeling and emotional experience associated with the current or potential tissue damage of a particular localization. Pain prevents any invasive procedure on the human body, that is a surgery. Hence, skills of pain control plays an important role in providing therapeutic service to the patient undergoing surgery. Modern science of anesthesia has played an important role in unprecedented development of surgery, which has been possible the wings of anesthesia. The first successful demonstration of controlling a pain during a surgery was carried out on 16th October 1846, and which is considered as a day of discovery of anesthesia. Till that time, there was no specialty called anesthesia. The journey of anesthesia can be split into three parts. What was happening before 1846 with regard to the control of pain during invasive procedures. 1846 to 2000, the induction period, and 2000 till now, the growth to the unusual or amazing heights of anesthesia, and the future is there for the expansion of this field. The means of controlling the pain with the herbal remedies goes back to the early civilization that even before 3000 BC. Various herbs and the products like opium from poppy seed, alcohol, and hemp were used to relieve the pain of suffering. However, as I mentioned in the previous slide, first public demonstration of modern anesthesia occurred on 16th October 1846 with the use of ether by W.T.G. Morton, that's William Thomas Green Morton, at Massachusetts General Hospital, Boston. Surgeon John Collins Warren carried out a surgery for the removal of the tumor on the neck of a patient by name Gilbert Abbott. Following the successful use of ether, following the successful use of this ether, which actually speaking on that time Martin had not declared that it was ether. It was amazing experience for the physicians who gathered there, and Dr. Warren expressed his happiness following the successful surgical procedure that this demonstration is no more a humbug. Before that, the surgeries were limited to the surface surgeries or removal of the gangrene, amputation of the limb only. The pain control used to take place with the unacceptable means, like hitting the head with a bamboo, making the patient unconscious so that he cannot feel the pain, or compressing the carotid artery, or acupuncture by Chinese, and hypothermia therapy with the cold water. As I mentioned, the Babylonians used to relieve the toothache with the henbane, that is hyoscyamus. Various gases played their important role in the development of anesthesia services. Joseph Priestley, chemist, discovered oxygen in 1774. He also discovered nitrous oxide. In the following year, Lavoisier called the gas which Joseph Priestley had discovered oxygen, and it was used as oxygen therapy for the people suffering from arterial hypoxemia or hypoxemic problems due to the reduction in the arterial oxygenation, and Systematic modern oxygen therapy was developed in 1917 by Holden and Warcroft. Subsequent to this, Holden, understanding the importance of oxygen in the treatment of hypoxemia in a controlled manner, as a drug. A reduction in oxygen supply to the tissue leading to anoxia not only stops the machine but wrecks the machinery. An important statement. Oxygen lack not only stops the machine but wrecks the machine. And the effect will be seen on the various important organs of the body, that is total functioning of the body. First, as I told, opium was used as painkiller for controlling the pain of childbirth. The opium as an ingredient of poppy seed. It was used in 1784 by James Moore for postoperative pain and a pain associated with the rheumatic arthritis. And the powder was stored in a lily jar. And from this poppy seed, morphine, a first pain reliever, was derived. However, there was no defined specialty like anesthesia in treating the patient for the surgical procedures. The operations were possible only for surface surgeries, removal of some skin lesions or cysts, amputation of the gangrenous limb, punctating cancer, and bladder stone removal. Nitrous oxide was used as a laughing gas for entertaining the rich people who attended the nitrous oxide parties for enjoyment. Dr. Governor Quincy Colton was used to conduct some demonstration of nitrous oxide parties. Dr. Horace Wells, a dentist working in Hartford, Connecticut, attended the party in 1844. He saw people enjoying, dancing, falling, getting injured, but they were not feeling pain. He was. Paraswals was a great scientist and a scholar. He was having a thirst to find out the measures to control the severe pain associated with diseased tooth extraction. When he saw the persons having severely injured, not feeling the pain, a thought came to his mind that he can try this for relieving the pain associated with the tooth extraction. So he went to Carlton and asked him to provide his services for tooth extraction the next day in his clinic. Dr. Carlton agreed, and Parashwal subjected himself to one of his friends for tooth extraction. Under the effect of nitrous oxide provided by Carlton. It was extracted and Parashwal didn't feel pain. Subsequently, Parashwal carried out multiple tooth extraction. October 1845, Parashwal took a step to demonstrate his success in front of noted physicians and dentists at Massachusetts General Hospital, Boston. But he was unfortunate. The person who underwent tooth extraction screamed at the end of the procedure. The honorable audience concluded that the demonstration was humble. Parashwal got frustrated. He was psychological upset and he ended his life in an unusual manner by cutting the femoral artery. However, his colleague, the student who was working with him, William Morton, was also dentist. Continued his practice of relieving the pain in dental treatment modalities using nitrous oxide and other substance, ether. His mentor told ether is more potent than nitrous oxide. Because Parashwal demonstrated without knowing Nitrous oxide is a good analgesic, without knowing, nitrous oxide is a good analgesic, but not anesthetic agent. Martin was convinced that ether is more potent anesthetic agent compared to nitrous oxide. He conducted demonstration in the same Massachusetts General Hospital, Boston, on 16th October 1846. As I mentioned, the surgery was carried out by John Warren Collin for the removal of a lump under the jaw on the left side of the neck. On patient Gilbert Abbott. And it was the first successful public demonstration. Dr. Warren concluded it was not a humbug. And on this day of 16th October 1846, the suffering of pain was conquered. Oliver Wendell Holmes coined the term anesthesia. The success of ether demonstration spread to UK, and on 19th October 1846, ether was used successfully in both Dumfries and London. This is the inhaler used by W.T.G. Morton in providing the service to relieve the pain. These are the gauze pieces soaked in the liquid getting vaporized as a means of a therapeutic agent to provide pain relief. These gentlemen are pioneers in the journey of anesthesia. Jackson was a mentor of W.T.G. Morton, and he had concluded the potency of ether was more than nitrous oxide, and he has contributed a lot in the ENT procedures, including laryngoscopy, discovery laryngoscopy. Clifford Long was a surgeon, had used ether in 1842 on a large number of patients, but he could publish his work in 1849, 3 years after the demonstration of Morton. Even though documents showed that he had used, he could not get the credit of a discovery of ether as an anesthetic agent, and the credit went to W.T.G. Morton as father of anesthesia. In the period of 50-55. Jon Snow was, was a practicing anesthetist involved in providing pain relief to women of to women for controlling the labor pain. Was successful epidemiologist because he invented cholera pump to control the cholera epidemic in London, and he is considered as father of epidemiology. He was practicing the pain relief services. At that time, in 1853, Queen Victoria was pregnant for her eighth child. She had 11 children, I believe. She was not ready to tolerate the labor pain, even though society was not accepting at that time. A means of aborting labor pains. They used to think it was God's will women should undergo labor pains for the benefit of a family and project. Even though chloroform was used by Sir Young James Simpson, it was not appreciated by the public at that time. However, now the queen was not ready to undergo suffering of labor. She ordered her ministry to arrange for a physician or a medical advisor who can control her pain. Subsequently, Jon Snow was invited. He provided pain control measure by using chloroform, and queen didn't suffer intolerable pain. And after the delivery of the child, she told she was gifted the pain relief with the chloroform given by Jon Snow. Subsequently, the practice of analgesia for childbirth was accepted, and Jon Snow became the first qualified anesthetist and he contributed a lot to the progress of anesthesia. The depth of anesthesia required for the surgical procedure was assessed only by the physical examination, and there were no scientific guidelines to assess the depth of anesthesia. Even though ether and chloroform were used, mainly the ether, the persons used to get anesthesia services with an inexperienced hand used to face the adverse risks and sometimes mortality. It was in 1937 Arthur Goodell came up with the chart to describe the stages of anesthesia, which occurs with the ongoing depression of the brain structure, because brain is the target organ controlling the other organs, including the respiratory center, cardiovascular center, and pain pathways. So the stages of anesthesia were described for the first time by Arthur Goodell. You know all 4 stages: stage of analgesia, stage of delirium, stage of third stage, a stage of surgical anesthesia, and 4th stage actually deals with the overdose of anesthetic agent leading to medullary paralysis. Means of maintaining the ideal anesthesia was to avoid the patient going to medullary paralysis or advanced stage of stage 3, leading to flaccid paralysis and palliation of the people. Maintain the anesthetic plane at 3 under stage 3. Anesthesia leads to loss of pain sensation, and analgesia. Analgesia. And loss of protective reflexes also. In order to maintain the patent airway for maintaining oxygenation, they came to know about the importance of maintaining the patent airway with endotracheal intubation. Sir Magel and Robotham invented the endotracheal tubes. In the early days, anesthesia was being carried out by pouring anesthetic agent like ether on a mask covered with like mask or a semmelbush mask or anchor mask by pouring a liquid over the causepiece. There was no controlled way of delivering the inhalational agent. So, British Oxygen Limited supported Dr. Henry Gaskin Weil to come up with the apparatus to provide anesthetic paper in a controlled manner. And Dr. and Boyle, H.C.J. Boyle, came up with the apparatus for to deliver the anesthetic agents along with the oxygen and other gases like nitrous oxide. And the company gave the credit to the inventor and called the machine as a Boyle's machine, the first version of the Boyle's machine. Simultaneously, its replica was invented by Gothami in America, Gothami apparatus. Subsequent development or modification in Boyle's machine have occurred, and now we are having advanced Boyle's machine. That's called advanced machine. It's no more a Boyle's machine. It is a workstation for providing anesthesia, which will come to know in the subsequent slides. Anesthesia involves also the calm and relaxed patient for surgical procedure. Otherwise, unnecessary injury to other important structures and blood vessels leading to hemorrhage cannot be ruled out. So there was a need for a skeletal muscle relaxant. Griffith invented D2-curare out of arrow poison, curare, a paralyzing agent having a temporary duration of a paralyzing effect, and by acting competitively with the acetylcholine esterase receptors. and he played an important role in providing a relaxed patient for a surgical intervention, reducing the amount of anesthetic agent required. Then there were further discoveries led to the other muscle relaxant, succinylcholine in 1944, and non-depolarizing muscle relaxants, pancuronium, vecuronium, rocuronium, atracurium, and nowadays variances are available. When the progress in surgery happened, surgeons started to use pottery. Halothane was, the ether was explosive. Didn't allow the use of pottery. So there was a need for more safer and potent inhalational agents, volatile agents, which can be vaporized to provide anesthesia. In 1956, halothane was discovered. In 1965, N-fluorine and isoflurane. Then subsequently, sevoflurane and desflurane discovered, and nowadays the common volatile anesthetic agents used for this used for providing anesthesia include isoflurane, sevoflurane, and desflurane. Which we can have a separate clause on volatile anesthetic agents. The journey of anesthesia further proceeded with the invention of endotracheal tubes and better quality endotracheal tubes, reinforced endotracheal tubes, and dedicated north and south pole endotracheal tubes. We cannot introduce endotracheal tube blindly. They have to be safely introduced to the trachea through the oral or nasal route. So a means of visualization of airway without causing a deleterious effect was essential, and laryngoscopes were invented. To start with, it was Macintosh, a curved blade laryngoscope, and Miller straight blade laryngoscope. Subsequently, with the research, ongoing research, and industrialization and scope from the various companies, we have got more advanced laryngoscopes, . to introduce the endotracheal tubes, including video laryngoscope, fiber optic bronchoscope. As I mentioned, anesthesia involves depression of a cerebral centers, lower center to the higher center, which will also control the respiratory and cardiovascular center. So a means of monitoring the vital parameters demanded more and more research and to come up with the state-of-art monitoring for monitoring the blood pressure, the pulse, respiration, temperature. As a result, multi-para monitors have been invented and have brought into the practice. So also dedicated anesthesia workstation. Now, so far we covered the means of providing anesthesia, that is the general anesthesia, entire body made unconscious. Temporarily made unconscious for carrying out the surgical intervention or painful procedure. But is it the only means of providing anesthesia? There were inventions with regard to other medical products and a means of introducing those products into the body. Alexander Wood discovered hollow syringe with hypodermic needle. And pentothal, thiopentone sodium, a barbiturate, was discovered to have hypnotic property. It was to be so how to use this product? Made John Lundy and Ralph Potter to deliver the drug intravenously, and the procedure was called intravenous anesthesia. It was in 1935. Ralph Waters and John Lundy used this. Subsequently, newer intravenous anesthetic agents like propofol, ketamine, etomidate, althecin, and so many others were brought into intravenous anesthesia practice. However, in 1884, Paul Kohler applied the drops of cocaine to the eye to carry out ophthalmic procedures. He found the patient was very much cooperative without blinking and without disturbing the system. So, he thought and he published it as an anesthetic agent which can be used locally for a particular region for making the patient insensitive to pain. The properties of cocaine were studied. Subsequently, and 1898, August Bayer delivered cocaine to provide a nerve block in the intrathecal space. And that spinal anesthesia or intrathecal anesthesia was brought into practice. Corning introduced the anesthetic agent in the peridural space. And his publication resulted in the invention of epidural analgesia. Nowadays, epidural anesthesia is advanced. We can provide a continuous epidural analgesia by inserting a catheter or combined spinal epidural anesthesia to take the benefit of spinal anesthesia for immediate rapid onset of action and continuing epidural supplementation of the anesthetic analgesic agent for longer procedure and post-operative pain control. Sicard and Catlin introduced the caudal epidural anesthesia, introducing the local anesthetic in the caudal epidural space. Then the inventions resulted in the discovery of pulse oximeter, end-tidal recording, oxygenation, end-tidal recording, ventilation, as I mentioned, video laryngoscope, and the depth of the nerve block can be assessed by peripheral nerve stimulator, depth of anesthesia by means by spectral index, and as I mentioned, workstation, which will help to keep all the required equipment in a safe controlled space, along with the monitoring facility, scavenging of gases, exhaled gases, and providing positive pressure ventilation with ventilator or manual ventilation, manual intermittent positive pressure ventilation. Now, you can have the recording of the entire anesthetic technique can be carried out, and it can be used as a evidence of the safe conduct of anesthesia. In the beginning, there used to be many mishaps because of the non-availability of ideal monitoring facilities, the safe drugs, fast-acting drugs, and other inadequacies. But now, anesthesia is safe with the experienced anesthesiologist with adequate depth of knowledge with regard to physiology and pharmacology of the patient dynamic health condition and effect of the drugs on the body. It is really safe, and anesthesia services are not limited to the operating room. Services, they have crossed the four walls of the operation theater to the services of anesthesia in critical care, intensive care area, trauma management, radiology, imaging department to provide anesthesia for MRI and other interventional radiology procedures. Optimize the patient in the anesthesia clinics to submit the safe patient for safe surgical outcome. Thank you. This is the overview of the journey of anesthesia specialty, which has resulted in the advancement of surgical procedures for various specialties, say general surgery, orthopedics, ENT, ophthalmology, obstetrics and gynecology, super specialties like neurosurgery, cardiothoracic surgery, transplant surgery, robotic surgeries, and even surgeries being carried out on the fetus within the womb. There is a lot of scope for the anesthetists nowadays. They are called perioperative physicians to carry out the researches in the various fields as a profession. Thank you. I am here to clear some of the doubts if you are having questions. Thank you. Thank you for your listen here.